guys, this is Dr. Blevins, and I think this is on. It told me to rotate my phone, but I don't know what it's doing. Is it on now? Okay, so maybe that'll work. Okay, hi. All right, so this is Leslie Blevins with Enilda Clinic, and we're going to talk about ACT today. So let's get started. ACT is acceptance and commitment therapy, and it's a really, really amazing therapy. I love it so much. It is basically a way of life. It's a process-based therapy, which means that it is just all about how you are thinking through the things that are going on in your life. There really is no end result. It's not like you're coming in and you're like, I'm going to fix this problem and then you're going to be done with it. It's all about changing the way that you relate to things that are happening inside your head and in the real world, so that you're living more abundantly and that you are just having a better time with life. And so, there's that commitment up front, but it's usually pretty pleasurable to learn ACT. And then over time, you really reap the rewards. And all the patients that I've worked with using ACT, I think that everybody really enjoys it. I have never had anybody be like, oh my God, I don't like that. People really like it. And so I'm really, really excited to talk to you about it today. So first, I'm just going to kind of go through the concept of ACT. And so it's basically a therapy that's designed to build psychological flexibility so that we're not so rigid, so that we are able to encounter complexity in our life, or situations in our life that are hard, so that we are able to do things better. And so there are 6 big processes in ACT. So real quickly, I'm going to tell you what they are. The first one is acceptance. And so it's all about accepting the thoughts and feelings that you have, even if those thoughts and feelings might be quite difficult. And we all do have quite difficult thoughts and feelings from time to time. Some of us have them pretty often. Now, this is a big difference, but for a traditional therapy like CBT, where the big goal there is to change the thoughts and feelings, to basically get rid of them to some extent. In ACT, we believe that you can't really change your thoughts and feelings. And so we are trying to have an experience where we're inviting them on the bus with us. And we're saying, if I have chronic pain, for instance, I might have this feeling of pain, but that doesn't mean that I don't also get to have my life. Or let's say if I'm a parent who has a special needs child, I might have a sense of grief with each new developmental milestone my child has, but that doesn't also mean that I don't have a sense of joy with each new developmental milestone, or a sense of frustration whenever they don't clean their plate or whatever. So then the next one is having a flexible awareness of the present moment. And so this one, everybody will recognize, is pretty similar to mindfulness. And so we can only really live our life in the present moment. We can't live in the future. We can't live in the past. And so this one is all about bringing yourself into this moment so that you have a really concrete way to take action. Otherwise, it's all in your head. The past and the future are all in your head. And so that's the kind of the flexibility piece. Now, for those people that have a trauma history, much of the trauma symptomology and much of your self-concept can be linked to past situations, and ACT does a great job about creating a linkage between the past self-concept that has brought you to the present and kind of reshaping that and bringing it into a more full understanding that beyond just the trauma, there are other parts of you that are present in yourself as well, outside of just the trauma. And so again, it's all about that flexibility. The third one is all about committed action. So in ACT, it's got a good problem-solving component to it. So there's a lot of behavioral activation going on for any clinicians who might see this. And so I find that for many of my patients, when they come in and we start to do our activities together, they sit there and say, okay, but what am I supposed to do? Like, I'm ready. Like, I feel like I get it now. Now I need some actual activities to do. And so that's where our committed action comes into play. And a lot of it is just solution generation, but then also having the commitment that you're going to try something new, and then again falling back on that acceptance that maybe the outcome will be great, but maybe the outcome will only be mediocre, or maybe it'll really suck. And that's okay, because solution generation and trying something new is what will really give you the experience to know what's going to work for you. The fourth one is values. Now, this is what I think is so amazing about ACT, is that it's not a therapy that just lasts for the situation that you're in, and then you find that it might be useless for future situations. It's actually a therapy that you link to who you are at the deepest core level and who you are striving to be as a person here on earth, who you're striving to be with your children, with your significant other, with all your family members, with your best friends, that person that you want people to know you as on your deathbed. And so ACT does an amazing job at really honing in on what those characteristics are, and then helping you to make those committed actions and to give you perseverance through acceptance and becoming the person that you want to be. And I think that's why it's so transformational. Next is the observing self. And so I'm going to do observing self and diffusion at the same time. So these are the last two. And so observing self is a concept of where, like, let's take, for instance, I'm a psychologist. So as a psychologist, maybe each of us has like these rules in mind about how a psychologist should act. And so maybe I do too. And so I think to myself, you know, I can't do this whenever I'm on a Facebook Live. Maybe I can't even do a Facebook Live because I'm a psychologist. Or maybe I can't go to the grocery store without having my hair brushed, or something like that. I've actually heard people say that recently. And so there are lots of little rules if I'm inside this psychologist self that tell me that I have to live a certain way, and it limits my freedom. But whenever I step back outside of those rules inside my head, and I'm just observing who I am whenever I'm totally free, I'm not a psychologist, I'm not a woman, I'm not a daughter, I'm not a sister, I'm not cat owner, I'm just me, then I get to be totally free, and I get to just observe the feelings I have about situations. I get to just observe the thoughts that are running through my head, and that gives me the true freedom to decide who it is that I want to be and what actions I want to take in order to move towards those values over a lifetime. Now, with that comes diffusion, because in each of our conceptualized selves, I think it becomes pretty easy to fuse with a thought and say that thought is reality. And so if I say, you know, I always have to be calm because I'm a psychologist, well, then that thought might always moderate my behavior, and I fuse with it because I think that that's reality and I don't have any other choices. And so it's controlling me. But what if one day I really need to say to a patient, oh my gosh, wake up, like you need to be angry, like, right? Like I need to like really have some power behind that statement. And I would get louder, but I don't know how that will come off on video. Oh, look at that fusion right there. Live in the moment. And so that's what fusion is whenever you have a thought running through your head and you're buying into that thought like it's real and it's reality. But really, my brain can have tons and tons of thoughts, and I can think anything in the world right now, and it doesn't make it reality. It just means that my brain's doing its job. And so those are the 6 core principles of ACT. The way that I like to do ACT is I use the ACT matrix, which I'll show you on my blank sheet of paper right here. And so just super quickly, what I do is I create a little diagram. There you go, now you can see it. And it's just a little 4-square diagram, and it allows me to create a visual where I teach my patients how to sort what's happening in their head. I find that when many people come in, they're like, oh my gosh, like I have a lot of distressing feelings about a particular situation, or maybe my life is just, there's all kinds of things going on, but they don't really have the patterns figured out yet. By putting it all on paper, we start to figure out what patterns are. So each of those 6 core processes I just talked about, we can actually start to identify on the map inside the 4 squares that I just drew on the paper. And so over time, by putting it on the paper and sorting out those thoughts, feelings, and behaviors, we start to recognize from an observing self what's really happening in our life whenever we're moving in a committed action way that honors our values, or whenever we're just acting in a way that is not accepting of an uncomfortable feeling. And so over time with that practice, we don't even have to write it down anymore. It just starts to show up in our head, and it's happening automatically. It's that shift, that noticing, that is the impactful value of ACT. Because in noticing, all the pressure's off. So I'll never ask you to specifically go do something. What I'll ask you to do is just notice how it feels to do something. So if you choose to not go to the gym, how does it feel in that moment when you make that choice? And by putting it down on paper at first, you really become aware of each of those things that are happening with you. Like, do you notice, gosh, well now I really start to feel guilty, but to manage my guilt, now I go eat some more, or maybe I go watch YouTube, or maybe I get cranky and I yell at my kid. And over time, you start to recreate new patterns that help you become the person and live the life that you want. And so that is ACT in a nutshell. I hope that you enjoyed this video. If you'd like to learn more about ACT, you can always go to enildaclinic.com. Be sure to sign up for the email list. We are going to start sending out the videos, the learning videos, through email, and I hope that you can get them in your email box by signing up. And then if you ever have any concerns that you'd like to seek out therapy for, please be sure to always ask your physician. All right, thanks. Bye.